Sydney Local Health District is a large tertiary and quaternary health service in the centre of Sydney. We've got 4 large hospitals and provide a range of services for about 600,000 people locally and quaternary services for people across the state.
One of our major vision statements is improved healthcare for all, and that goes across our clinical as well as our technical services. We're here to improve our patients' care and their lives. We've had a partnership with Cerner now for over 20 years, and we've seen huge improvements with the introduction of the electronic medical record.
It really has revolutionised the way in which we provide care. For me, it wasn't so much about a techie purchase, it was really about clinical transformation of what we do on a daily basis.
One of the main advantages of having an electronic system is the consistency of information, and also the accessibility is a main advantage.
It's put information at our clinicians' fingertips. So where they previously may have had to search for information, it may have taken minutes or hours to track down paperwork, they now have that information instantaneously at their fingertips at the patient bedside.
EMR has changed my life. It means that I can be in any of the locations where I sit, so that's here in RPA, across at Lifehouse, in my office, or any of the other satellite buildings, and I can be phoning my outpatients, I can be following up and documenting at the same time. Makes life very efficient.
We've just recently implemented Vitals Link into our largest emergency department that sees around 80,000 presentations annually.
The nursing staff now can seamlessly transmit the patient clinical observations through to the EMR using device integration. It saves them time and it helps improve their workflow.
All of what we do is about spending time with our patients and building relationships, building rapport. Having this technology in place really provides more time for the nurses to spend at the bedside, providing quality care for their patients.
One of the advantages is the automatic alerts that come up. If a doctor charts a medication that has potential interaction, one of the things that fires off when a pharmacist reviews that medication chart is a notification of that interaction as well. That's one of the strengths of the decision support tool.
The clinicians report that's the best thing that we've ever done for them. It just demonstrates that what is perhaps a relatively simple implementation can deliver significant benefits.
The other benefit that I see is around our ability to use the data that has been entered into the EMR by our clinicians in relation to analytics, and really starting to work on that data to try and pull it all together to tell a story.
That can enable us to actually look at our evidence-based practice and incorporate changes and improvements into what we do to improve our service to patients, obviously as a priority, but also to make our systems more efficient.
We're at the point now along our sort of Cerner journey that we've got all the groundwork done. We've got a fantastic base layer there, and now I think we're really seeing the benefits of that and utilising the technologies that are now being made available for really fantastic new innovations.
Our partnership over the last few years has really demonstrated that the Australian market can generate fantastic ideas and that those ideas translate into improvements that the whole world will benefit from.